Fats are absolutely bad for your health, so it can destroy you. Get into your arteries and block your heart. Fat can kill you. Fat can destroy your life. Fat can be devastating. Fat can ultimately cause death. That's quite actually accurate. But you should also know that not all fats are bad. Some are good too. So the next thing that you would be doing is doing a lipid profile. So how would you understand what each of these numbers mean? Now, especially if you're not a doctor like me, you will end up with a bunch of numbers that you don't totally understand. So guys, in this video, I want to show you what each of these numbers mean and how you can quickly fix them if they happen to be abnormal. So stay tuned. So guys, I'm considering that you have a lipid profile in your hand right now. So the first thing that you would be doing is looking at the total cholesterol. Now, if it happens to be under 350 milligrams to a deciliter, then it's totally fine. Then you move on to the next one, and that is the triglycerides. So what is triglycerides? They are blood fats. They are synthesized either from your sugars or carbs. Now, if you have low triglycerides, then it goes to say that you have been controlling your diet pretty well. So everything good so far. Next thing is the HDL, high density lipoproteins. Now see how I'm really stressing on the word protein. It is a protein, guys. It is not cholesterol. Now LDL and HDL are two carrier proteins. Now think of it as a center and a periphery. At the center you have a liver and the periphery is your body. There needs to be certain communication between these two centers by means of carrier proteins, and these carrier proteins are HDL and LDL. Now HDL is high density lipoprotein and it's so called the good cholesterol. Now LDL can be of two types, LDLA and LDLB. LDLA is a larger molecule, LDLB is a smaller one and more dense. Now you can understand the smaller ones are notorious to get into small spaces, and that's what makes it really dangerous. So if you have elevated LDL, you really do not understand where it's coming from. It can either come from LDLA or LDLB. The next question would be, how do we know that? Now, obviously there is a test available for LDLA and LDLB, but that's quite expensive. Now you're better off doing it in a different way, and I'm going to show you a little hack. Now we belong to the land of India, where it's called the land of Jugaad. So I'm going to show you one Jugaad of that kind. So stay tuned. So guys, let's talk about the jugaad that I was talking to you about. So you have a situation wherein your LDLs are high. Now you do not really understand where it's coming from. Is it the less dangerous LDLA or is it the more dangerous LDLB? Now I'm going to show you a quick hack, okay? So your situation is LDL is high, all right? Keep that aside. Now the next thing that you should be doing is look at your HDL to triglyceride ratio. If both of these happen to be going in the same direction, meaning both of them going higher, if they're showing a higher trend, the chances are that the LDL is coming mostly from your LDLB, which is a dangerous situation, guys. If your HDL to triglyceride ratio is both going downwards, meaning both of them are lower than they should be, while your LDL is high, then it's probably coming from the less dangerous LDLA. Next obvious thing is what contributes to LDLA and what contributes to LDLB. LDLA is primarily increased when you consume a lot of saturated fats. Saturated fats are really not that bad after all, okay? So LDLB is dangerous. So where does LDLB come from? It comes from trans fats. It comes from your processed and refined oils, canola oil, soy, and hydrogenated fats. These are the dangerous things. These are the dangerous fats that I was mentioning earlier. So try to avoid canola oil and soy. These are really going to be bad for your overall cholesterol and lipid profile. You will end up with a heart disease if you continue to consume such foods. So stay healthy, cultivate good habits, and get fit. That's more important. Get healthy, get fit. So that's it from here, guys. I hope I made some sense with regard to the lipid profile and everything. If you still have any questions, do let me know. Throw them up in the comment section. I'll be really happy to reply. And also do check out my other videos on IGTV and also on YouTube. Go to youtube.com/Drsinghtastic. All right, guys, signing off. I'll see you in the next one.